Welcome to Back in Motion Health Talk, where we dive into the health issues that matter most to Baton Rouge and beyond. I'm Dr. Justin Walbom, chiropractor and clinical director at Back in Motion Disc and Joint. Each week, I sit down with trusted voices from across healthcare to bring you real conversations and practical advice, covering everything from pain and injury to stress, movement, and recovery. Let's cut through the noise and get you informed and get you back in motion. All right, how you doing today?
Wonderful. Excited to be here.
Yeah, welcome. We're so glad to have you. It's nice to kick off and start a podcast with an interesting topic. And your clinic in particular is very intriguing. And it's a topic I think that many people in Baton Rouge are interested in or curious about at the very least. So today, folks, we're sitting down with Brittany Sibelle, who is a family nurse practitioner and the director and owner of Drip IV Lounge and Aesthetics here in Baton Rouge. It's over on Perkins Avenue and has a great clinic over there. So welcome to the Back in Motion Health Talks podcast. So good to talk with you. Why don't you introduce yourself to everybody and tell us a little bit about yourself?
Yeah, absolutely. Hello, everyone. As you mentioned, I'm Brittany, the operating partner of Drip IV Lounge and Aesthetics, where we do a little bit of everything. We do some micronutrient IV therapy. NAD is a big buzzword right now. We've been doing that for quite some time. A little bit of regenerative health in stem cell therapy, which I know we're going to dive into. Few different things.
Yeah, the thing that makes this topic so interesting to me is not just the idea of having a IV lounge or regenerative medicine. That's been a kind of a field fairly well established for many years. But what's interesting to me in recent years is seeing the people that are now entering that field. So you're a nurse practitioner, Dr. Peck, who is the medical director, is a medical doctor, obviously. And tell me what your background is actually in emergency medicine.
Yeah.
So how do you go from broken legs and gunshot wounds to wellness?
It's those 12-hour ER shifts that'll do that to you.
I imagine they're not very fun.
Okay, how do we prevent the emergency room? So a lot of what I saw in the emergency room was people would come in on their deathbed and we would give them a bag of fluids.
Pull your mic up just a little bit closer. There you go.
A little bit better?
Yeah, that's much better.
So we would see them on their deathbed, essentially, give them a bag of fluids, and these people would turn completely around. And that was my aha moment about IV therapy of, we have a dehydration problem. And hydration fixes, in sepsis, okay, when you're really, really ill and you have multi-organ failure, we're giving you fluids. That's like a big part of the protocol. And so IV therapy clinics make so much sense from a health and wellness perspective. Let's catch it before we get to that point, before you get to the pneumonia because you weren't feeling well and you weren't hydrating properly.
Yeah. So interesting that you mention it in terms of wellness. The very first thing, no matter what, anytime you go to the hospital, the first thing, we got to have IV access. So what is it about IV that makes, certainly convenience, the fastest way to administer medications or anything else. But in terms of wellness, what makes IV superior to regular oral supplementation or transdermal or other mechanisms of delivery?
I do like transdermal, but when we're talking about oral, you're requiring on a strong gut microbiome to be able to break that down, to be able to absorb it and utilize it. And unfortunately, in America, with our SAD diets, the standard American diet, that's not the case. And so now we're bypassing this obstacle, delivering it straight into the vein, which everybody knows absorption via IV is always best. And so now you're getting this delivery of vitamins, minerals, nutrients, amino acids into the body, and it turns people around. It's incredible. The things, even I've seen somebody's blood work. If you don't mind me sharing an example.
Yeah, please do.
There was a lady who her gallbladder was not good. I did labs. Her kidneys were seeing the hit from her gallbladder as well. And so gave her fluids, repeated her blood work, and it was perfectly normal. And I was like, wow, this does more than I even realized that it does.
Okay. So just in terms of, so these are the things that I think about as a doctor when I consider whether or not to send somebody to do an IV, because there's certainly some things that if vitamins, mega dose of vitamin C, large dose vitamin C is absolutely amazing. Some of the results that have been seen with that in clinical trials, as well as things that are best absorbed that way. I use a lot of glutathione, and glutathione is a substance that through the gut, it just gets totally destroyed. Now, we can mitigate some of that by using a liposomal form, which is fantastic. And I use that here as part of my neuropathy protocols. But certainly IV is more direct. And certainly you're going to get more bioavailability through an IV. But the concern that I have, if I'm recommending that, is what is the stress on the kidneys? What is the stress on the cardiovascular system in doing that? Because you can't do that like every week, can you?
I mean, once a week would not be horrible. I tell people every 2 weeks, even once a month, there's significant health benefits. If you're coming once a week, I'm kind of digging into like why, what is going on. I have some POTS patients who their nervous system has trouble regulating, and they really benefit from IV hydration. So those are the patients I'm seeing a little bit more regularly. But for the most part, it's a little less frequent. But you made another good point of its absorption orally, but also then dosing, right? So glutathione oral, you're going to get a much smaller dose, or if I give you an injection of glutathione, where I can give you up to 2,000 milligrams of glutathione IV and really get in there, knock out some inflammation, detox the body, et cetera, et cetera. That's one of my favorite things we offer, by the way.
Yeah, glutathione is an amazing therapeutic. And we use it a lot because it has some amazing neuroprotective properties, particularly with people with peripheral neuropathy, where you're trying to regenerate nerve. You got to have that glutathione in there in order to get rid of all of the stuff that's damaging, all of the oxidative stresses. So yeah, that is very intriguing to me. You always wonder, well, how often can you do it? Because
no, that's fair.
And dosage too, because if I'm consistent throughout, I'm taking an oral glutathione, say I take a liposomal glutathione every single day, consistency versus big dose that does what? How long is your body able to utilize that and to clear it?
You're asking me?
Yes.
How long?
Yeah.
I don't have the best answer for how long, like if you got an IV, because I do have people who are like, hey, I'm getting an IV, but most of the things we give are water soluble. And so they're in and out really quick, but you give me something to go look up.
Yeah. So I find it fascinating because certainly it's absolutely the most effective way to deliver. But
for sure.
Yeah.
And you can test glutathione levels. That is something that we offer. We offer micronutrient testing, but for the most part, clients are not coming in and getting tested. It's just an extensive history. I want to know what supplements you're on, and definitely medical history. You talked about the kidneys, heart. That's the first thing I ask somebody. Do you have heart, kidney, liver, or lung issues?
Yeah. And that brings me to another question about, because this is something that I think people don't understand and maybe, have heard things about IV lounges in the past, is that they're not regulated, but that's not exactly true.
No, they're heavily regulated, and everything we do in the building is FDA approved, which means it's coming from a facility that is developing these micronutrients in a very regulated space by the FDA. However, it's not it's FDA regulated, not FDA approved, because vitamins are never going to be FDA approved.
Yeah. That's always that's a sore spot for me, because honestly, the system that we have is not really a healthcare system. It's a reactive care. It's sick care.
That's right.
And so the FDA doesn't regulate things that are actually help people to be healthy. What it does is it regulates the things that are responses to illness and sickness. So, but I think what I was getting at is that it's important. I think important for people to realize that the decision making in administering an IV therapy, whether or not somebody walks in and just says, "Hey, I have got $200. I want to get a drip." It's not just that easy. It's not just walk in. Walk me through your process.
Yeah, so you'll come in, we'll get a general idea of what is ailing you that day, and then you meet with a nurse practitioner, and which oftentimes if you come to my clinic, it'll be me, unless you're there on the weekend. And I get a good understanding of what's going on with you, and then I guide you in therapy that I think would best be suitable for you. Patients can certainly express interest in things, but oftentimes that plan changes based on what I guide them to. Often glutathione. It's kind of the best thing, definitely if you're not feeling great. But so yeah, and then there's a registered nurse who will start an IV on you. You get your IV drip, you check out, and we see you later.
And right on down the road. Now, I didn't mention this before, but it came to my mind actually a couple days ago, and I didn't talk to you about it. But do you guys test for toxins?
No, I would love to get more into that. Currently, the only testing we do is a full micronutrient panel that's like 70 different micronutrients.
That's fantastic. Most people aren't doing that, but there are quite a few functional medicine doctors now that are in this area that are doing micronutrient testing as well. But the thought came to my mind because just the number of people that I'm seeing come in with peripheral neuropathy, they're not diabetic, they're not metabolic, but these are people that have worked in the petrochemical industry for years. And of course, we live in Cancer Corridor.
That's it.
And so all of these people that have potential toxins that are bound up, do you have therapies that you administer that will methylate and clear a lot of those toxins?
If we're talking toxins and something I would administer in the clinic, the IV alone is going to help flush the system out. There's B vitamins often in our drips, but we specifically use a methylated form of B12 methylcobalamin. And then outside of that, glutathione is really, if we're looking detox, that's where I'm going. The IV itself and glutathione. NAD is not a bad choice either for just helping the body cellularly repair and optimize things. But I know I keep saying glutathione, but truly it's my favorite.
Well, there's a reason for it. Honestly, of all of the therapeutics in terms of supplementation, if we're talking toxicity, we're talking about oxidative stress, because it is a really powerful antioxidant.
Right.
And so, no, I understand why you're mentioning it, and it's really great, actually.
And just for your listeners, so that we've given you a little background. So glutathione is naturally made in your liver. It's how we detoxify. It's good for decreasing inflammation, boosting your immune system, boosting your metabolism, boosting energy. So it hits a little bit of everything people come in looking for in general. But yeah, that's just the long and short a little bit about glutathione.
Yeah, and so when we're talking supplementation, we're not talking about anything that's like some froofy chemical snake oil type new creation. We're boosting the body's natural ability to create and utilize glutathione.
Right. And you started talking about neuropathies and you're seeing these kind of weird things. Well, glyphosate is this massive issue that we have here. And so glyphosate is what's in Roundup. It's sprayed on all non-organic crops. But the problem with glyphosate is that it is water soluble. So when you spray it, it's in the air, it's in the water. And so even if you're eating the most pristine, clean, organic diet, you're still coming in contact with high amounts of glyphosate. And so that is some testing that I would be most interested in, is like, what are my glyphosate levels?
Oh, 100%. And, I read just the other day that this was, I wish I could remember where the study came out of. I want to say Cleveland Clinic, but it could have been somewhere else. So don't hold me to it. But people that lived within a mile of a golf course were like 3 times more likely to have Parkinson's.
Yep.
Wild. That is so crazy.
What it does, it ruins the tight junctions in your gut. So you hear all of this leaky gut stuff. And so that tight junction's only about a hair thin.
Yeah.
But it's strong. And so you're damaging that. And so now things that are meant to be contained within the colon are sleeping out into the bloodstream. And it does some crazy things to the plants as well. So, and this kind of goes to the micronutrient deal. So it ruins the shikimate pathway within the plant. That is how it folds its proteins. So not only is it damaging our gut, but now our food is not nutrient dense anymore.
Yeah.
And so, yeah.
What do you attribute that to? I have my own theories on this, but what do you attribute that to?
Truly glyphosate and the way that we form, fast forming. So we don't allow the soil to regenerate, regain its nutrients, and then harvest. We are a fast, go, go,
Monocrop
go.
agriculture.
That's it.
Yeah.
Yeah.
The other thing that I've seen over my career is the explosion of celiac disease. And on top of that, not full-blown celiac, but, gluten sensitivity and food allergies. And my thought, just as I've seen the nutrients, the nutrient dense foods that we eat, even the things that you think are nutrient dense are not necessarily nutrient dense anymore, because the way they're farmed, the way they're harvested and grown in a monocrop fashion or with genetic engineering, it ruins the nutrient availability in these things
Massively.
So
my favorite saying I've ever heard is it the gluten or the glyphosate? And so these things have a very intimate role. And you'll see this huge uptick of Hashimoto in young girls. I keep seeing it in young girls for whatever reason. Gluten is heavily tied to the thyroid and dysfunction. And so I really think it all comes back to our gut health. And so you're not getting the vitamins, minerals, nutrients your body really needs to support and thrive and even just detoxify.
Yeah. This chain of just unwell youth and young adults in our society is unbelievable. And short story, I had a patient a while back, and so she was on statins. She drank like 12 cups of coffee a day. She had thyroid problems. So she didn't have her thyroid out. So she was taking Armour thyroid, and she was, I want to say, she was definitely hypothyroid, for sure. But she came in and she's wondering why her muscles are always so tight. And I'm like, well, the statins affect 100% of people that they take them in terms of muscle pain or muscle tone and muscle function. And that's what a lot of people, have you read the most recent research on statins?
No, I mean, I talk about them a lot, but I don't know most recent. Tell me, I'm curious.
They're finding that the tie of hypercholesterolemia and heart disease is more tenuous than they used to think. And the use of statins has not really been shown to lower risk of stroke or heart attack. And so now we have this whole chronic medication epidemic that we say, well, why are we prescribing people all of these things with so many detrimental side effects? Because I always like to tell people, there are no side effects to medications. There's only effects. There's the desired effect, and then all of the other effects that you had no clue it was going to do that you didn't really want. And particularly with statins here in my office anyway, because we deal with a lot of musculoskeletal pain, is the muscle tension, the muscle tone, the muscle pain. And, rhabdomyalgia or rhabdomyolysis is a real thing.
Absolutely.
But the rhabdomyolysis would be something in a small population, but the majority of people actually do experience muscle pain or muscle tension. They have chronic trigger points, myofascial issues. So, I forget kind of where I was going with this, but the point is that our society has all of these things that are external stimulus, whether it's through our diet that we're taking in or our environment with glyphosates being sprayed on everything and in the air. And of course, here in Louisiana, we've got the mosquito foggers going. We don't want malaria or West Nile or any of that. So we've got all these chemicals that are aerosoled in the air. And then our agriculture is not and even organic. That's a really kind of a gray area too, because depending, there's the soft fleshy vegetables that are more beneficial to be organic, and there's some of them that maybe not.
Yeah.
And then,
I think, following I at least tell people follow the little EWG daily dozen and the dirty dozen and the clean 15. That's what it is.
Yep. Dirty dozen, clean 15.
You know, you brought up statins, and it's kind of my favorite thing to talk about. And so you were talking about how, so there's two reasons why hypercholesterolemia. So two reasons why two reasons why you would need to raise cholesterol in the body. So first of all, it's due to a response of high acid in the body. That's what it is. There's two things your body can do. We've arrived. It can raise cholesterol, or it can borrow calcium from your bones. And so you have this high acid state, and rather than your doctor saying, hey, look, we have a diet issue, let's bring in some more alkalizing foods, not water, that is different, more alkalizing foods, cool off this inflammation, cholesterol naturally comes down. They put you on a statin, which halts the production of cholesterol. Well, cholesterol is a normal, natural, necessary, needed thing in the brain. So I think, this is my non-professional opinion, that this is why you're seeing all of these early dementias, and it's getting crazy, the amount of people I see with that. And so, yeah, I'm kind of on a mission to be like, let's talk about red yeast rice. Let's do something else. And then it depletes your CoQ10 levels.
Yep.
And oftentimes they're not prescribed CoQ10 or ever educated on CoQ10. And so you're really putting yourself at more risk. And so as your cholesterol levels get lower and lower and lower, there's an argument out there, you're increasing your stroke risk by like crazy amounts.
Robbing Peter to pay Paul.
Yeah.
You know, because, it's absolutely necessary for proper neurological function. So that's why this research was really intriguing to me, that the tie between heart disease and cholesterol is not necessarily, everybody says good cholesterol and bad cholesterol, but there's only cholesterol.
Yeah.
Like you need LDLs and HDLs, and you need triglycerides, particularly now, if people are losing, that's the other thing. So I actually went to my doctor a few years ago, and I was in the middle of dropping some weight. I think I was in the middle of dropping about 40 or 50 pounds at the time. And he took my cholesterol levels, and they were elevated. I'm like, well, what do you think my body does with the fat? Like, if I'm burning fat, I've got to have triglycerides to mobilize it.
Yeah.
Like the triglycerides have to be higher because I got to move that fat to the liver to be metabolized.
Right.
And it's oftentimes, I don't want to lump everybody into the same box, but it is a frustration that oftentimes specialists in particular get so myopic in their approach to patient care. If they've got high cholesterol, I've got to lower it. If they've got high blood pressure, I've got to lower it. If they've got, whatever markers, they're going to attack that because they're in their bubble without looking at the whole picture and going, okay, you're in the middle of weight loss. Or, somebody that doesn't need to genetically, like my resting blood pressure in high school, and I was an athlete. Probably doesn't look like it now, but I used to be an athlete. My resting blood pressure was 135/85, which for a 17-year-old is not really great, but it's always been that way. So yeah, if I'm 190/110, that mightn't be a problem. But I had somebody tell me at the age of 20, you got to be on blood pressure medication. I'm not sure I was jiving with that.
Yeah, no, I don't think that's advice. Not all advice you should take.
Yeah. So, but I think that our system, well, tell me what your opinion is, because I have seen almost a renaissance in the general public taking interest in their health, especially since COVID, in terms of, and what I mean by that is they're not just, well, my doctor said it, so I'm going to do it. I've got people that are saying, well, I've got this neuropathy and they gave me gabapentin, but I don't like it and I'm not going to take it. Or they gave me muscle relaxers, but I'm not going to take it because, they're questioning things now. Are you seeing that same thing?
Absolutely. And just people coming to me with knowledge that I don't typically see them having. I think right now the RFK Maha movement, you're going to see a ton of this where people are really going to wake up to our healthcare system. But yeah, I think that we are taking our power back a little bit and realizing, look, just because a doctor gave it to you or a nurse practitioner told, like, it doesn't necessarily mean, and I think these people are not ill-willed. I think they are doing what they are trained to do. That is what I was trained to do as a nurse practitioner. I just so happened to finish school and feel like, I still don't know why you have high blood pressure. I can prescribe you a pill, and I know pharmacology very well, but I don't feel like I'm getting to the root cause, and that wasn't enough for me, which led me back to going back to school to be a regenerative health practitioner. And so luckily it's at a good time, because I do think people want more control of their health, and they're seeing at these young ages, I am sick, I am unwell, I'm unable to go to the bathroom. Like, sorry to talk about poop on here, but constipation is a huge issue. That is recirculation of toxins. And it's in so many young people that I talk to. I almost talk to everybody I see about this. I'm like, tell me, are you going to the bathroom? But anyways, so we're waking up. I think we're realizing we cannot just put all of our faith and trust in doctors or walk-in clinics or whatever it is. You really kind of, in 2025, need to take your own control of your health. And I think we're doing that.
Yeah. I did actually recently, I did a solo podcast where I was talking about insurance and talking about primary care and specialists and kind of how they should work together. And I think that our system has kind of gone away from how it was originally designed, in that a primary care doctor was originally supposed to manage a case utilizing the information coming from specialists. And now they're kind of a referral hub. So you go see your primary care. Oh, you got a heart problem. Go see the cardiologist. And that's the last you hear of it. You know, there's a few out there. I have a really good one, but there are a few out there. But for the most part, my neurologist did this and my cardiologist did this, but they're not talking to each other. And it's really a problem when you have this compartmentalized source of care. You know, chiropractors historically have been a holistic practitioner. They look at the whole. So if you got low back pain, I'm also going to look at your neck, but I'm also going to look at your knees and your feet, because kinetic chain can affect all of that. And on top of that, you got low back pain, or you got take shoulder pain. I can't tell you how many patients, well, I can tell you, it's probably in the 30 to 40 range, patients that I've had come and they have pain in their right shoulder, and they say, this thing just will not go out of my right shoulder. And I do an evaluation. There's nothing wrong with the shoulder. Well, what the heck? There's nothing wrong with your shoulder. Why does my shoulder hurt? Well, you know what? I'm going to send you for an ultrasound. And their gallbladder is just full of gallstone, diseased gallbladder. So you got cholecystitis. But if I'm a shoulder doctor, then I'm looking at the shoulder and only the shoulder. I'm not, you know what I mean?
Yeah.
So this idea of holistic approach to healthcare with concierge practices, with regenerative health, this idea is kind of a new approach, I think, that we're seeing take hold in our healthcare community, which I think is fantastic. And the reason I brought that up is I actually had a recent experience with a patient who, totally unrelated issue, came to get chiropractic treatment, and after their first treatment, doesn't always have, because the body takes time to heal, okay? But sometimes they're these weird things, okay? So I adjusted this patient, and they came back for their second visit, and they said, can this affect my bowel movements? Well, why do you ask? Well, I've had IBS for years, but just removing the pressure off of the nervous system and stimulating the parasympathetic nervous system through a chiropractic adjustment was able to free up the enteric nervous system to do what it's supposed to do, and it regulated her bowel movements. And there's ways to look at the body more than just I'm an eye doctor, I'm a heart doctor, and we need those people. Don't get me wrong. I'm not saying we don't, but it's exciting to see this kind of renaissance into wellness and regenerative health. Tell me, because you do IVs, and we've talked about the glutathione, but you do other things in your clinic as well.
Yeah. So, stem cell therapy is one of my favorite things that we offer.
You know, that's a really hot button topic, especially in our community that is heavily Catholic, and there's a lot of concerns surrounding stem cells.
I'd
Go
love
ahead.
to get into that. So actually the company I work with is a Christian company. And so they do a lot of education on the sourcing of these stem cells. So when the question comes up is stem cell therapy illegal? Yes, it is illegal in the United States to use aborted baby. That is not the business we are in. I am so far from that. I am a do no harm to anything, not even the spiders on the ground. I free them. So sorry, my headphones keep falling off.
Let's adjust this so that they're not quite there.
Beautiful.
Here, I'm gonna pause here for just a second so that we can adjust some technical equipment. And we're back. Okay, technical difficulties averted. Okay, so we were talking about stem cells and the way you source them, the company that you use.
Absolutely. So we use Infinity Matrix cells, and these cells are sourced from healthy dad, healthy mom, healthy baby. They decide they want to donate the cord. They are heavily screened and monitored throughout the pregnancy. And once baby is born, they go on their happy way, and that cord is harvested. That's the process. So there's no harming of anything. Rather, it's a beautiful donation of something that could have been thrown away. Instead, it's life-giving to another person, which I think is really beautiful. It kind of completes that circle of life. And so how we do this is we do an extensive consultation and medical background and screening and determine appropriateness of the therapy. But stem cells have this beautiful innate wisdom. I mean, we were developed from them, right? They contributed to the formation of your muscles and tendons and eyes and ears and toes. And so they have the ability and the potential to go in and regenerate many different things in the body. And I like to call them heat-seeking missiles looking for inflammation. They're amazing for targeting inflammation. And most people who are coming in with different conditions have some degree of inflammation. If you have an illness, you have inflammation. And so they prioritize what is going to be A, B, C, and D of what's going to be repaired. You might have diabetes and you also have an old shoulder injury. And so they're going to determine what they're going to fix first, second, and third. But I've seen some pretty amazing things.
Yeah, I think that the future of healthcare kind of it is going to be tied to stem cells. There's a lot of research that still needs to be done on it. Delivery mechanisms, how do you get them? And I think it's important for people to realize everybody has stem cells. So when we started out embryologically, they were all stem cells. And then through certain stimulus, the cells start to differentiate and become a toenail or a skin cell or a heart cell or whatever it is. And there is quite a lot of regenerative medicine that uses people's own stem cells. So they'll harvest, fat tissue and spin out stem cells and then re-inject them. And then there's what you utilize, which are umbilical cord stem cells. Don't want to misspeak there, because it is. Are you familiar with the restrictions? Can you explain a little bit of what's illegal and what isn't illegal?
So as far as I have learned, anything from like amniotic, embryotic, those types of things are a no. And certainly not something I want any part of. How I was telling you how I came to stem cell therapy was actually from a patient who was telling me the amazing benefit it had on her rheumatoid arthritis. She was about 80. She was at the point of having to live with family members and no longer able to be independent. And she got stuck in the bathroom. And so her mobility issues were really becoming a problem. Got stem cell therapy and has been pain-free ever since. And if you heard her on the phone, it would not match up with the person you see in front of you who has your typical rheumatoid arthritis swan deformities. And so that's how I came to stem cell therapy. So it wasn't some salesman or anybody trying to get me to bring this on for financial gain. It was somebody who was on fire for stem cells and just wanted them in this community specifically. They wanted stem cell therapy in Baton Rouge. And so, yeah, that's how I came to it. And these are really the only ones I plan to work with. I think I struck gold with this company. They really care about the purity and quality and the regulatory aspect from the FDA. They're following all FDA required screening, plus an additional 8 different screenings. Non-COVID vaccinated, that's a big thing for them. And just making sure that they're monitoring mom throughout that pregnancy to make sure that this is a good sample. They only accept about 5% of their donors. And so highly selective. And when I'm thinking of stem cell therapy and what I would want in my body, that's the process I would want them to go through. Very rigorous screening and very selective.
Yeah, I think that's important. It sounds great. And I maybe want to come back to stem cells, but you mentioned something that is, maybe we can talk about it without risk of losing our license now. And that is
We're walking a fine line.
Yeah. I wanted to get your opinion, and I think that the public needs to hear this, and I'll probably talk about it with most of my guests, and that is, what's your take on how COVID was handled and where we're at now with mandatory vaccines or vaccines in general?
I don't think we'll have any more mandatory vaccines after that.
Fingers crossed.
Sure, hoping not. I was working in the ER at the time, and it was lose my job or get the vaccine. So I got the vaccine. And look, no judgment on people who feel that is what's best for them. I think there was a lack of education and informed consent on vaccines. And I think that we woke up a lot after what went down. And while it wasn't widely publicized, I saw a lot of injury from the COVID vaccine. I still treat patients who were still not right 2 years later after the vaccine, and after COVID itself. And so, yeah.
Yeah, and you look at the VAERS report, the vaccine adverse event report is called the VAERS report, and there's a lot of information in the VAERS on the COVID vaccine, but it's underreported for sure. There's a lot of people that have this long haul COVID issue, and it's hard to tie it to the vaccine because of the mandate and how many people just blindly went to get it. How do you, and then still got COVID? Mm-hmm. So
it was told you had to get it to protect the person next to you. However, it was very well known that the vaccine did not affect that at all. I was not protecting anybody other than myself, which I would argue I'm not positive that happened by getting the vaccine. But
yeah, it's a wild event in healthcare. And I'm not an immunologist, but I took immunology and I took public health in school, and everything that happened from the moment COVID came out, I'm like, oh, well, why? This is a coronavirus. Why would they shut everything down? That makes no sense. They're not going to shut everything down, because all that will do is create a wildly resistant strain of the virus.
right.
It's way back when herpes zoster, chickenpox. Mm-hmm. And, I don't know, you're probably a lot younger than me, but, when I was young, it was somebody kid in the neighborhood got chickenpox. I said, go play with Jimmy. Go get the chickenpox. Get it done. Because the immunity that you got from that from a childhood disease that was fairly harmless to children was by far more effective than whatever vaccine happened to be around. And so just what I knew from immunology and from public health, I'm like, why would they do? And then they did the complete opposite. And then this whole thing with, it almost brings me to the point of rage to see people walking around with these masks on.
It makes me feel sad because that's fear. That's out of fear.
Yes.
Right? And so to still be living in that state of fear and the lack of education of, hey guys, we got this one wrong. Okay, let's roll it all the way back. Now, I did see that they're no longer recommending the vaccine. I can't remember where the age group stops off, but in children.
Yeah.
I was like, okay, at least we're there. At least we've done that.
Because correct me if I'm wrong, but they had the greatest incidence of like endocarditis.
I believe you're correct.
Yeah. So I'm glad that they pulled that, but like everything they did was completely opposite of everything that I had been trained as a physician that you should do for an illness, or for a pandemic or an epidemic, particularly as it relates to a virus. So yeah, it was really wild. And
I'm happy we're past that.
yeah, and every time I'm driving and I see somebody driving alone in their car with a mask, I'm like, what is going on?
Which is not good for your immune system in general.
Yeah.
You need exposure to different things. I view viruses as an upgrade to your immune system. Okay, I got sick. Great. That's new information in my system. We've now upgraded.
Do you think as a society we are overly protective against pathogens?
Yeah, I think we need to put down the hand sanitizer and play in the dirt.
Yeah, a little bit more.
Yeah.
To be clear, wash your hands after you go to the bathroom.
Absolutely.
But
I'm the biggest hand washer. I was a patient of St. Jude. I've had a bone marrow transplant. I probably am the worst hand washer. Like, I wash my hands too much, but just the alcohol on your hands and the hand sanitizer, like, definitely in kids. Like, I'm going to try really hard once I have children to not always make them clean their hands if they're just playing outside in the dirt. That's what we did when we were younger.
Yep.
I've hardly ever been sick my whole life outside of that big event.
Wipe your nose on your sleeve and be happy about it.
And
move on. Yeah, sounds good. I really think it is very beneficial for our immune system overall to be exposed to low levels of pathogens. And, for most people, they may not realize that there is fungus among us. We are surrounded by bacteria and viruses and fungus everywhere on almost every surface. Did you do the thing in school where they gave you a swab and they said, go swab, listen, we're going to grow cultures?
No.
Yeah. So we in school in microbiology, in grad level microbiology, we did a comparison, and, it was kind of a for funsy lab thing, So what do you think? We had a pool. What's going to be the most have the most pathogens on it? And so we would grow, and we would grow the cultures and then differentiate the colonies and see what was growing what. And it's just the oddest surfaces, like you're probably too young to remember payphones, but
I remember payphones.
Payphones, gross. Phones in general, like people's cell phones. Back when we used to hold them to our ears, just.
I've always heard the hotel remote was the worst.
Yeah, we weren't at a hotel. I couldn't test that.
I've always been freaked out by those.
Yeah, and then they put the little band around and it says, "This has been sanitized for your protection." Yeah, except for at the no-tell motels, which. When we moved, me and my wife, we moved from out west, and we were moving to. I think we were moving here. We were moving to Louisiana, actually, in 2000. And we stopped at this place just outside of Oklahoma City called the Green Carpet Inn. And it was late at night, and we were just like, we just need to stop somewhere. And we walked through the door, and it was so gross. We were like, maybe not.
Maybe sleep in the car.
Yeah, it was an experience anyway. So you're a transplant from Lafayette.
Yeah. Yep. I moved here in 2022 to actually open Drip.
And how you like it?
I love it.
Like Baton Rouge?
Go Tigers.
Go Tigers. You got to say it Coach O style. Go Tigers.
I'm going to leave that one to you.
Anyway, so you've started Drip, and it sounds like it's going really well and helping a lot of people.
Absolutely. Honestly, you guys have an amazing community. I consider myself a resident here now, but I've met some wonderful, wonderful, beautiful people, and I'd like to think been able to help quite a bit of people in Baton Rouge.
But that's not all you're doing, because you got a new venture coming up, don't you?
That's it. Yeah, I touched on that a little bit earlier. I became a nurse practitioner, realized this isn't it for me. There's more out there, and so I became a regenerative health practitioner. And
so what's the difference between a traditional nurse practitioner and somebody that does regenerative health?
So nurse practitioner, you are trained, here's the diagnosis and here's the pharmacology associated with what we're going to treat that diagnosis with, right? Mm-hmm. And in regenerative health, it's really that whole body approach. What are the organ systems out of balance that has led to this state of disease? And we like to say, don't be dazzled by the diagnosis. You do the work works. And so it's really with the understanding that the body has its own innate wisdom and it's designed to heal. It is not designed to attack you in these autoimmune conditions. It is responding to something. And so if you listen to the body's whispers, you won't have to hear it scream. Unfortunately, a lot of us are out here screaming. And so when you start to peel back the layers of, okay, so let's remove some of these toxins we're putting on our skin. Let's change the water that we're drinking. Water's a big one, guys. No tap water. No more tap water.
Amen to that.
And the food we're putting in our mouth. That's a big one. And I know in Louisiana, we have a really hard time with that. So what I will be doing and developing is actually retreats out of my home because I love to cook and I'm a Cajun girl from Lafayette, so I can throw down. And I'm doing it with all plant-based, whole, organic foods where you'd be like, oh my gosh, this is amazing. What is this?
We can still eat boudin, right?
I say anything in moderation, okay? I'm not here to take away your coffee, although I would much prefer it be mold tested, low acid, organic. Guys, coffee is one of the most heavily pesticide treated crops. Okay, if we are ingesting coffee every morning that's not organic, it's a huge hit of acid to our system. And remember, when acidity rises, so does cholesterol. Mm-hmm. So just an awareness of these things, right? I don't expect perfection, but when you take the body out of a state of overwhelm, it can handle some insults every now and then. Right? It's just that everyday constant. We start our day brushing our teeth with fluoride, and then you wash your face with some chemicals, and then you take a shower with some chemicals, and it just compounds in our body. Our
living
hormones.
In a chemical soup.
That's it. That truly is it. I was looking at, what was it? It was the amount of chemicals like a newborn will be exposed to in just this short period of life, right? When they come in, and it is no wonder why we are getting sicker and sicker in our 20s and 30s. You don't even have to make it to 60. You can have all the illnesses you'd have by 30 almost now. It's truly wild. And some of the main complaints my people have is brain fog. Who does not say have fatigue and brain fog? Okay, well, another issue we have in this world is parasites. If you have a pulse, you have a parasite. It's normal. Part of our parasites are normal. We have bacteria, parasites, viruses, things that live.
Yeah, some are good, some are good, some are not.
That's it. And in other countries, they understand this well. You need to be parasite cleansing and keeping these things in check and in balance. And that leads to acne and all these other issues that we have, brain fog and fatigue. And so we're kind of not living our own lives. We're just subject to all the things that are around us and in us, and we don't do any cleansing. That's regenerative health. We're going to cleanse you. We're going to take an internal shower.
Kind of bring back to a kind of a baseline of what the body should be.
And it's amazing what you can reverse.
Yeah.
Even like the big C. I've seen those reversed. And so that's really my mission, is to give you the tools to make yourself better. Don't depend on the doctor anymore. Depend on yourself with knowledge and empowering you with knowledge, and also leading you to water by showing you my great food.
Sounds good.
Yeah.
Sounds good. I'm on board. Do you find, so this has always been a challenge throughout really any physical medicine, physical therapists, chiropractors, anybody that relies on the body's natural healing, innate healing. We live in a society that's like microwave popcorn. I want it now. Give it to me now. And if my neck hurts, but a muscle relaxer will make it go away, now. Doesn't fix a problem. And I've yet to meet anybody that contracted a disease from acetaminophen deficiency. So do you find it a challenge to work with people and get them to the expectation that, yes, their body can heal, but it will take time?
100%. It's a huge challenge. I think setting expectations up front. Your body did not get this way overnight, right? How long have we had this illness? How many things have you tried and battled? It's going to take time to heal and regenerate. But the great thing is the more you take care of yourself on a nutritional level, the more that the body has the energy to repair. But if you don't have energy, your cells don't have energy. And they're certainly not able to detoxify you and repair you in the way that's needed to get you over this illness. But it takes time.
Yeah.
It does take time.
Now, I hope you don't misinterpret this question, because I only ask it to illustrate a point. When you were in school, how much nutrition training did you get?
Almost none. I couldn't even talk about a carb when I got out of school. So that is what my program taught me. And I tell everybody, I didn't know anything about nutrition. So don't think that I'm coming from this place of I'm better than thou. Like, I've only eaten organic since like January of last year.
Nice.
Yeah.
And the letters at the end of the name don't mean anything.
No.
You know,
I think doctors get 4 hours.
If that.
Right.
If that. I've talked to several colleagues, medical doctors, and try to talk to them about nutrition and their Mediterranean diet. And that's about the extent.
Right.
You know, well, okay, but you know that the pastas and the vegetables and stuff that we have that are heavy in Mediterranean diets that we have, they're not the same as that they have in the Mediterranean. So like the gluten amount of gluten sensitivity and gluten rich pastas that we have here in the United States. So just because you're eating pasta, you're getting lots of carbs and not a lot of nutrition.
Right.
It's not the same as a traditional Mediterranean diet. And even you have a salad. Well, okay, yes, I'm having a salad, but it's loaded with Olive Garden dressing.
Right.
Well, you might as well be eating a Big Mac at that point.
Yes, exactly.
No offense, Olive Garden. Let's make that clear. It was just an example. But there's so much sugar and so much processed stuff, and the oils, seed oils. What's your take on seed oils? Because that's
so inflammatory, so bad. I think it's part of why processed food is so bad for us, despite the fact that it's not food, it's chemistry. Like, read the label.
Yeah,
there's no food in that.
And have you seen the process, like what they do to oil to make it that? Because you walk down the cooking oil, and it's canola oil and vegetable oil, and they all are the same color. Do you know that that's not the color they are?
No.
Like, it's gross. If you see how they actually process, they bleach it and they extract, and then they have to add a dye to get it to that pretty color that's on the supermarket aisle. So, and you're right. So you were saying about the oils and how they affect what oils are good.
So if you're cooking at high temperatures, I'd probably go for an avocado or a coconut oil. And then if you're making a salad where nothing's going to be cooked, extra virgin olive oil is wonderful. But those are pretty much the three I stick to. You're going to want to avoid pretty much all the others. Yeah.
Yeah, they'll, so I don't know, years ago there was this big thing, cis fats and trans fats. And if you're cooking with a oil that has a low smoke point, like it doesn't transition well, you switch from that cis to trans configuration, which your body can't handle.
Yeah.
It creates all kinds of inflammation.
There's a lot about when we cook food, we're changing the actual chemistry of the food. And that's why you've always heard you lose nutrients. Microwaving your food, guys, throw out your microwaves. I didn't think that was possible. I haven't used a microwave in a long time. But it's just totally destroying any nutrition in your food. But I don't think that we, as a whole, view our food from a nutritional standpoint. We view it from a pleasure standpoint. Mm-hmm. I like to merge those. I love to enjoy food, and I do not eat rabbit food. People think I just eat carrots. No. And speaking of dressings, like making your own dressing, I have some of the best dressings in the world that I haven't tasted anywhere else. And so I think that we really need to get back to, why do we eat? We eat to nourish our body. What are you nourishing your body with? Is it nourishing you?
Yeah.
Most times, no.
Teaching people to shop on the outside of the supermarket and avoid the inner aisles.
That's it.
As a process. And I really think that, it sounds like you and I come from the same school of thought, in that it's the quality of food that we eat, and these processed food. RFK Jr. has a lot of controversy surrounding him. He's a trial lawyer by training, but man, can that guy research.
He knows his stuff.
He knows his stuff.
He really does.
The thing that I was so within my sphere as a chiropractor, we've been talking about for years, and that is the things in our food that make it not nutritious. You know, the difference between a medication and a toxin is dosage, right? And the same thing with food. If we're eating food, we call it food, but it's loaded with all of these processed ingredients, like bread that lasts on the shelf for months.
Right. Yeah.
How?
Yeah.
How? If there was any nutritional value, you'd have stuff growing on it.
Right.
Right? Salad, and I look at what are they spraying on these salads in these containers that make them last for 2 weeks on the shelf in the supermarket.
It's too good to be true.
Yeah. So we do a lot of things for economy, and there's, don't get me wrong, you know, we're feeding a lot of people worldwide with the new technologies that we have, but there's a trade-off, and that trade-off is we're not growing our own foods. We're not delivering the amount of nutrient-rich foods, and yet our foods are designed to not satiate as quickly, so people are eating more, so more calories of empty nutritional value, and hence why we have an obesity epidemic. And then it just chain reacts from obesity to metabolic disease and diabetes and neuropathies and cardiovascular disease. And, you know, if I were to choose one condition to improve the health of really anybody, any human, but here in America, if we could eliminate obesity, I'd say about 80 to 90% of our chronic health problems go away. Right. You know, you ever watch the videos of PE back in the 60s and 70s?
No.
These guys, just these high schoolers, and they're just jacked. They're ripped, you know, doing pull-ups and doing calisthenics and stuff. And now you say, oh, you have to take physical education. Oh, I'm getting a waiver.
Yeah.
My back hurts. I don't have to participate.
I just think it's all taught and learned. When you think about our diets, too, I think about this a lot. And look, I don't have kids, so y'all crucify me later, but they only learned to eat McDonald's because that's what they were fed. Now, great, I was fed Hamburger Helper and whatever, and I'm fine, okay? I don't think that, but it's getting worse. And I watch this kid on Instagram. He always somehow comes up on my feed. And he's reviewing McDonald's all the time, and he's obese. And I'm like, gosh, we're doing this for likes, but this kid is in a world of hurt coming soon. Like, it's not going to take him till he's 30 to be ill.
Oh, yeah.
And it's just sad. I just don't think that it's totally realized that this is the actual cause. But I do think people are waking up to it. And like you said, the RFK thing, I think RFK Jr., I always call him RFK. But people are realizing this is an actual problem. And I guess all we had to do was put it in the news. So I'm happy it's in the news.
Yeah, I think it's a great thing. And, you know, like it, hate it, it's at least creating awareness for people to come around to pay attention to this stuff. That, you know, this is maybe tinfoil hat here, but it does make sense that our foods, like, we want the softest thing, the softest this, that. And food companies have designed foods to be soft so we don't chew as much. Because when you chew, you release serotonin. And if you don't chew as much, the serotonin release is delayed, so you eat more. Right. You know? And and I understand why people are eating McDonald's. It's cheap. It's convenient. You know, we're a busy society, and most households are two-income households. So you're both working 40 hours a week, and then you come home, and kids need to be fed. And I can either spend an hour and a half making dinner of high quality food, or I can stop by McDonald's. I can pick something up, and everybody's happy.
And that's my biggest thing is everything that I make takes me less than 30 minutes. Almost everything. And some of it is cooked, but a lot of it's not cooked. And so the more we're consuming things in their raw state, you're getting in more minerals and nutrients. And I understand needing a more like warming, grounding kind of meal. And so like lentil soup is something that takes me almost no time. It's delicious. Every time my fiance is like, this is so good. I'm like, yeah. And he's like, and I don't miss the meat. And so I took somebody who's a basketball athlete who pretty much predominantly eats plant-based. Do I think that everybody has to be plant-based? No. Let me just scream that for the people in the back. No, but I do think taking those principles and incorporating a lot more plant-based food into our diet, especially fruit. That's one of the easiest things you can do is consume more fruit. Fruits are detoxifying. There are cleaners. And so the challenge I give a lot of my patients who are coming to me wanting to lose weight is fruit until noon. Okay. We're going to take all. So now we're bringing alkalizing foods in, foods that are hydrating, loaded with vitamins, minerals, and nutrients, and just make that your breakfast. I want you to start with warm lemon water. It naturally detoxifies the body, lemons in the body go more alkaline, although they seem like an acidic fruit.
Yeah. It's not, it's, somebody explained it to me that it's the ash that it's the alkalizing ash from the metabolizing of the food rather than what its raw form is.
Look at you. I only learned that in regenerative health. I had never heard that anywhere else.
See,
but yes.
Should have been a chiropractor.
I'm behind the curve. Literally.
But the other thing is that I was going to ask you about is as it relates to, oh gosh, now I just lost my train of thought. It was tied right in with this. GLP-1 inhibitors. So we're talking about people losing weight and improving their nutrition. And do you do GLP-1 inhibitors in your practice?
Yes. So we do GLP-1s. I don't think they're a perfect peptide. I don't love the delaying of gastric emptying. So I think that if this is a drug that you are interested in, you need somebody who's really going to educate you beforehand and use it in its appropriate form, following strict BMI guidelines. So
for the appropriate length of time.
That's it.
Yeah.
That's it. Like, I want to use it as minimal amount of time, help us reach our goals. We're going to learn totally new behaviors while you're on this medication, because the moment you stop taking it, it'll come right back. If you're still eating whatever you're eating that put it on in the first place, it's going to come right back. And so it gives us a great opportunity to work with people who wouldn't be able to really get this weight off of them otherwise.
Well, and people
understanding we need those bowels moving. Remember, I told you.
Oh yeah.
Bowels.
Yeah, for sure. And that, like, tirzepatide in particular has some side effect. It can actually increase bowel motility. It can create a dehydrative state and a hypersalinic state within the body, which is not great. But on the other hand, look, I had a colleague back in, when was this? It would have been early 2000s, who literally lost his license to practice because he was telling his patients, I can fix your diabetes. We're going to remove the sugars from your diet. We're going to detoxify your system, and we're going to cure your diabetes.
Quick.
And that was taboo. He literally lost his license over that. Now, what's happening with diabetes? Type 2 diabetes is going away with these GLP-1 inhibitors. Now, I'm not saying that they're a cure-all, but when we have somebody in a metabolic crisis where they can't metabolize sugars and they can't deliver sugars into the cell, they can't get energy to the nerve tissue, they can't get energy into the muscle tissue, and they're literally flooded with glucose, but they're starving on a cellular level. And we've got people with heart disease and cardiovascular disease, and they're atherosclerotic throughout their entire body. And if we can just get rid of the inflammation, if we can just get rid of the metabolic crisis and get them to a state where their body can just breathe,
right?
Cellular respiration, back to the Krebs cycle from high school biology, that process is so complex yet so simple. That if we can establish back to a baseline homeostasis with people, our entire society just changes. It changes our point of view, because and it's not just a physical health, the mental health crisis. How much of mental health is tied to poor nutrition and poor metabolic health?
And it's because those hormones are made in the gut. About 80% of them are made in your gut. So if your gut is not right, your brain's not right.
Well, in the neurotransmitter, there's more serotonin in your gut than there is in your brain. Yeah. And so when people say, well, don't think with your stomach, well, maybe you should.
Yeah.
Because having a gut feeling, there's a lot of neurotransmitter, and the enteric nervous system itself is so profound and complex. And if we don't have the appropriate nutritional components to maintain its health, everything goes into a tailspin. I've said on many occasions, I think that the least desirable job as a medical practitioner would be an endocrinologist, because you move one lever, it's like putting your finger in the holes of the dam. You've got a leak here, and then the other one springs a leak. And trying to balance all of the hormones and neurotransmitters in the body, the endocrine system itself is just so complex.
In which everything we've been talked about are endocrine disruptors.
Yeah.
All of this stuff is affecting your hormones, especially that statin. One of the coolest things I saw was that, so if you look at the molecule of cholesterol, all of our hormones are made off of cholesterol.
Yeah.
So if you stop making cholesterol, what's happening to your hormones?
Yeah.
It's so connected, and yeah, the gut is, we could probably have like a whole podcast just on the gut, but that's where I feel like we gotta do the diet stuff, because that's where it's going, right? It's going straight there.
Yeah. So tell everybody, what is this program called that you're launching?
It's going to be called Sprouted. It's still not there yet. I'm kind of growing Drip and growing this in the background. But yeah, I'll be launching it and kind of shouting it out, I'm sure, off of Drip's page once I'm fully up and running.
Well, that's fantastic. All right. So tell folks where they can find you.
Yeah, you can find us on Instagram at Drip Ivy Lounge BR, or on our website at dripivyco.com.
Fantastic. And people need to call you to make an appointment. What's the procedure for coming in to see you?
So for IV therapy, we do accept walk-ins. You can also book online. If you'd like to book a consultation for stem cells, just go ahead, give us a call, 225-256-3634.
Fantastic. Well, we've been chatting for about an hour. Let's wrap this thing up. We want to thank everybody for joining us for Back in Motion Health Talk, and we will see you on the next podcast, where we'll talk about everything health for Baton Rouge and beyond. Until then, stay back in motion.